For people in the private insurance market, you're going to get a great deal of variation. If you're in New York, the state of New York actually has some fairly strict insurance regulations. A lot of the horror stories that you've heard about are not happening here in New York because the state wouldn't allow it. But lots of other states don't regulate insurance as strictly. So, yes, Moore's correct about that. There's no question that, the stat that's thrown around a lot about the fact that medical costs are the leading cause of bankruptcy in the United States is very real. There are lots of people who don't have insurance or who are underinsured who will go into a hospital and run up a huge bill. Now, you have different kinds of hospitals. In New York, we have the second largest public hospital system in the world. The only one that's larger is Paris. So all of these health and hospitals corporations, hospitals, you can go in with no insurance and they will care for you and they will do lots for you as much as they can. They're all operating on difficult budgets, but they'll do as much as you can. And they're not likely to turn you over to a collection agency if you've had to spend 3 nights in the hospital later. The other hospitals in New York City are all not-for-profit. These are not for-profit hospitals. We don't really have for-profit hospitals in the U.S. And in fact, most of the East Coast in the U.S. is dominated by voluntary or nonprofit hospitals. When you go out west, you'll see more for-profit hospital chains, just because, the country started really on the East Coast, and you have this long history of voluntary hospitals that started up nonprofit hospitals, and you don't have the same tradition. But even in these nonprofit hospitals, which are, by the way, subsidized by the government through the tax code, they receive huge tax subsidies. If you go into the hospital and you spend 3 or 4 days and you can't pay your bill, most of the time they will turn you over to a collection agency. And you can easily run up a bill because of the cost of medical care in the U.S. of $20,000, $30,000, $40,000 or more overnight. And so if you don't have insurance and you have the misfortune of getting sick, and there are lots of people who fall into this, you can lose everything very quickly. It's still a minority of the population. Most people never have that experience. But enough people have it that you can tell lots of stories. With a country of 300 million people, you can easily get 10 or 20 million people who are affected.
Another thing that's mentioned.
One of the things that happened is after Truman tried to get national health insurance passed and failed, they decided they wanted to do something to improve the health of the public. And the thing where they were able to get bipartisan support was to plow millions of dollars into this big public research entity. And so the research done at the NIH itself and research done by university professors all over the world, funded by NIH, also provides a lot of the basic science and even some of the applied science, which is then picked up and used by the pharmaceutical industry. So even with all their excess profits by overcharging the U.S. for unpatented drugs, they still wouldn't be able to do what they're doing if it were for that huge public investment in the basic science stuff. And so it's a dilemma because on the one hand, as Dan suggests, a lot of these drugs have helped people. It's not that these things aren't useful. Some of them are, of questionable use, especially these days with lots of Me Too drugs. But a lot of the things that have been developed over, say, a 60-year period have been enormously beneficial to people. But at some point, you're spending huge chunks of your gross domestic product on healthcare. And even if the only thing you care about in life is health, which is questionable to begin with, it turns out there's other stuff that influences your health.
I was just going to get your view.
Yeah, I think you've answered it already, but what country would you say had the best solution for America? What would be realistic for America to?
I've been to China. I don't recommend that system. But beyond China, there's really nowhere to go but up. I would take the English NHS in a heartbeat, and the English NHS has some serious problems. I mean, they really do restrict access to high-tech services and some drugs that are fairly effective. They have a fairly low budget for healthcare, although Tony Blair bumped that up before he left office. But even the English system is far better. The Canadian system is far better. I think the French system is quite good. Now, having said that, I mean, the French system has some problems. They don't coordinate anything. People doctor shop all the time. If you look at the consumption, not the price, but the consumption of pharmaceuticals, the French are taking more drugs than anybody but the Japanese. And they're among the healthiest people in the world. And I don't think it's because of the drugs. I mean, they're over-consuming pharmaceuticals. The fact that they have the same surgery rates as the US once you control for need is troubling, because we're doing too many surgeries. Even with our adjustments, we're doing too many surgeries. No, I don't want to offend Dan, he was a surgeon, but we're doing too many. So there are problems within the French system. In fact, we're going there next month to conduct site visits because we're doing a small area analysis of access to primary care, and you get variations within the French system. It's not a perfect system, there are none. But, I mean, the French do two things very well. They cover everybody. There are out-of-pocket payments, but unlike the US, the French have a long list of chronic illnesses. And if you have been diagnosed by your physician as having one of those chronic illnesses, you never have to pay out-of-pocket. You're exempt from out-of-pocket payments. Those are only for people who are reasonably healthy, just to give them a slight incentive not to over-consume healthcare. And as I said before, they have a delivery system where they saturate the system with primary care. And those two things together, even when you don't coordinate things very well, and you don't use your data very well, you know, I mean, my standing joke when I teach classes in international health systems is that every morning, the ministers of health in Germany and France and Switzerland wake up and thank the good Lord for the United States. Because if it wasn't for the United States, we'd be holding all sorts of international meetings trying to figure out why the French and the German and the Swiss spend so much on healthcare. But they can always look at the United States and say, well, at least we're not them. Because, you know, we're spending 10% of GDP, but we're not spending 15% of GDP. And we cover everybody, and things are better here, and they are. So, you know, of the systems we've looked at, I think the French system probably is the best. And as I was saying before, what's interesting about the French system is that because they expanded incrementally over nearly a century, it gives you a little bit of hope within the US that maybe, even if you're making modest adjustments over time, eventually you can get there. We seem to be taking as much time as humanly possible, but you know, in the case in Denmark, you have probably the most extensive use of electronic medical records on a nation level. I actually haven't seen a lot of studies to suggest whether or not that has resulted in the kinds of either reductions in cost or quality improvements that everyone thinks it will. But I know from speaking with people who have actually worked within the system, much like people who work within the US Veterans Administration health system, I mean, the doctors within the system and the patients within the system really like it, because you do have, you know, I mean, having that infrastructure in place really makes it much easier in many ways, at least in theory, should make it easier to avoid certain kinds of mistakes and coordinate care. Whether it actually, you can tell me whether it actually does, I'm not sure, but those are my two impressions of the system, that it does work fairly well for those reasons.
Because in Denmark, you don't give a clue about Denmark.
No.
It seems as if everybody prides themselves of having sort of reached nirvana.
Yeah.